Good afternoon, everyone. I'm Jenny Montgomery. Thank you so much for joining us today. How are you feeling? That's a question that got a big response a couple of weeks ago when Elmo posted on social media. The truth is, we aren't all fine. Many popular books and articles feature helpful hacks to reduce anxiety, manage emotions more effectively, improve life satisfaction, and cope better with stress. And they're needed because, according to Mental Health America, anxiety is currently the #1 mental health disorder in the U.S. Roughly 40 million people suffer annually, and that number is growing rapidly. We saw a 25% increase in anxiety during the pandemic. Unfortunately, less than half, an estimated 37%, receive professional help. Hurdles include affordability and accessibility issues. Health and wellness coach Michelle Byton suggests a 5-step alarm program to help manage and prevent anxiety, even in kids. ALARM stands for Activate Your Parasympathetic Nervous System. Try doing mild exercise, meditation, yoga, deep breathing from your diaphragm, even nature walks. Label what you're feeling. Acknowledge that emotions are temporary. Remember to avoid layering your thoughts and emotions. Move forward and take action. You can learn more in Byton's book, The Instant Anxiety Solution. Another major mental health concern is depression. In the United States, some 21 million people have it. And of young people ages 12 to 17, more than 15% have major depression. As we mentioned a moment ago, some of the roadblocks to getting help include ability to pay and accessibility. And that's where Channeled Paths comes in. Cheryl Carswell is the co-founder, director, and CEO of Channeled Paths, and Tonia Gibbons is the interim executive director. Thank you both for being here today.
Thank you for having us.
Oh, I'm really excited to share this information. I think it's so important. And before we get into it, I just want Cheryl to share one quick story. Cheryl, you had 20 years or so in a private practice, and you decided to sell it and to retire, and that was good for a few weeks, and then you're like, nope, I still have more to give. I'm in the service, I serve people. And it gave you the opportunity, though, to really broaden this nonprofit, which is Channeled Paths.
It did, and I am so excited to have this opportunity, excuse me, to continue working and do what I do, which is counsel people. And I saw the greatest need was for children. And a lot of children are uninsured, underinsured, they don't have insurance. And so I thought, what can we do to help them? Because giving is the greatest gift. So we decided, my business partner and I, we decided that we were going to use our ability and our supports to fund nonprofit and see children at no charge.
I think it's a wonderful thing, and we'll tell you a little bit more about Channeled Paths right now. It is a nonprofit organization that offers counseling programs for emerging adults, at-risk kids, and children with special needs. And Cheryl, that is, sometimes we forget about children with special needs, and how it is important that we have these services for them and their families.
It's very important, especially the ADD, ADHD, Asperger's, these children who don't really fit in society, to know how to work with them and give them an opportunity to talk to us and tell us what their needs are.
When you're talking about that, your team has extensive experience working with children, and you have certifications. These are important for parents to know. You have certifications in therapy supervision, forensic counseling, and eating disorder therapy. That covers a broad range of mental health issues that can affect young people.
Absolutely. And adults are not treated much different from young people. They just grew up with their same problems. And all of these eating disorders, those are teenage problems too.
Right.
And kids suffer from that, but they don't understand what to do or how to get help. So that's what we're all about, is getting that help for them.
I read something on your website that was interesting to me, and you said that when you talk about children. You mentioned children with ADD, with ADHD, with ODD, defiance disorder. What was the O? I forgot what the O is for.
Oppositional defiance disorder.
Oppositional defiance disorder. That was new to me.
Yeah.
These are the result often of what's happening in the family situation.
Absolutely.
There's a lack of respect for authority.
Absolutely.
And without intervention, it can lead to further issues, to substance abuse down the road.
Absolutely, and you're correct about that. So we want to catch this early. We want to give these kids an opportunity to talk to someone who isn't afraid to talk back to them. A lot of times parents just don't know what to say. And I had a situation where a parent had lost a child to suicide. And so she told me, she said, I didn't know what to say to him when he told me how he was feeling. I just didn't know what to say. So we hope that we can catch those kids.
Yeah. Tonia, you are catching kids in a 19-county radius in Georgia.
Yeah. The way the program is worked is we're referral based. So basically working with your school systems, with Department of Juvenile Justice and other partners in the community that have children that could possibly fit the program.
Yeah, they're the ones who can flag the children that are going to need special services.
And it's not just that we want to exclude everybody else, but those are the ones that we're targeting because we know they have issues. We know they're dealing with things. We have an MOU with Bridge Builder communities as they're bringing those children out of foster care. They're going to need counseling. We are working with other organizations within the community like Augusta Partnership for Children. So if they have families that need to be referred to us for this program, those are the ones that we're taking as well. And so going into the school system and going into DJJ, we actually have a meeting with them on this Wednesday to present to become probably a partner with them as well. So we just want to make sure that those communities that really see those type of children can refer to our program so that we can get them the counseling that they need.
And I want to make sure that we put our graphic up on the screen where folks will know how to get a hold of you. You meet with your clients either in person or online.
Yes.
And you have the ability to do one-on-one or group.
Yes, absolutely. So our office is located at 4434 Columbia Road, Suite 205. And we have therapists. We have a therapist network, if you will. So we have therapists in different locations because a lot of times the barrier is transportation. What if there's a child that can't get to Columbia Road, but we're partnering with a therapist that's on Central Avenue and that child lives in the Harrisburg community? So it's a little bit of a barrier breaking thing that we're doing because a lot of times it's access, but it's also lack of insurance, it's lack of a knowledge.
Yeah,
we don't even know
one
that
of the things
this
we talked about at the top.
Absolutely.
Right. Accessibility and ability to pay.
Absolutely.
Right.
And that's one of our key things that we look for in the children that we serve. And we're 501c3, so we're a nonprofit, which means we do different types of things, fundraising. We look for grants and opportunities to bring funding in to cover the cost of those therapy sessions.
So, Cheryl, I want to make sure that we're getting the point across that you are referral based.
We are.
So a parent doesn't really need to pick up the phone necessarily and call you.
Not necessarily, yeah. Even the child could call us and say, I need some help.
So they could.
They
They could. They don't have to come through a school counselor.
No.
Okay.
No.
Okay.
So we're open. We don't turn anybody away. And so we're excited about that. And another component that we're getting ready to offer is parental counseling, so they'll know about the children and what's going on in their life.
Well, that makes a lot of sense. Yeah. Because if you're just working with a child and that parent isn't kind of looped in, then you might not be reinforcing what what each other is doing, that sort of thing. Well, I just wish you the best. You can find out a lot more information about Channeled Paths by going to their website, which is channeledpaths.org. You see the information right there. The phone number is 706-910-0538. And they're easy to find on Columbia Road in Martinez. Cheryl and Tonia, I wish we had more time to talk. It always goes by so fast, but this is such important information, and I'm so glad for the community to learn that you do exist and how they can either take advantage of the services or support Channeled Paths, because that's what they need.
Thank you so much.
Oh, you're welcome. You're welcome. We'll be right back.